We collect data from a randomized trial. 045 is a second-line setting. This is a registration trial of pembrolizumab, and 361 is a phase III trial for first-line chemotherapy, first-line urothelial carcinoma. We put together both trials, and we collect around 109 patients with the mixed histologies, and around 400 patients with pure urothelial carcinoma. And we try to figure out how they do with pembrolizumab, the mixed histology, is compared with pure urothelial carcinoma. What we have seen in this abstract that the overall response rate is quite similar. 40 in mixed histology compared to 30 in pure urothelial carcinoma in second-line setting, and 20 and 21 in first-line setting, so quite similar. If we want to look at the overall survival data, they are similar as well. I mean, 14 months compared to 13 months, so quite similar, and progression-free survival as well. I think we have to. Of course, there are some limitations. For example, we have no data about a type of variants. We know that neuroendocrine tumor is not included in this in both trials, but we don't know which kind of mixed histology are treated. Because we know that adenocarcinoma is different from sarcomatoid, that is different from other type of variants. So we miss this data, but we have tissue, because the tissue was mandatory for both trials, and maybe in future we can go into in more detail in this important question. The second limitation, in my opinion, is that we have to look at the chemotherapy in this particular population, because we have data with pembrolizumab, but we have to compare the response and overall survival in mixed histology, even in mixed histology treated with chemotherapy. How to do in that way we can know if better immunotherapy or is better chemotherapy.